Did you ever wonder what happened to public health care in Ontario? You've probably noticed that our hospitals certainly aren't what they used to be. You can wait for 10 hours or more for emergency room care, days for hospital beds to open up. And when you do get in, many local hospitals have had to cut important services like obstetrics, chemotherapy, MRIs, rehab, and lab tests. Lots of people are getting bills for things that used to be free. Sick people are being sent home way earlier than before, and community hospitals are losing beds or shutting down completely. How bad is it? Well, our Ontario is now tied for last in how much we invest in our hospitals per capita. Here's the story of how this happened to healthcare in Ontario and how we can fix it. Spoiler alert. The next part of this story is pretty depressing, but there is a solution, so stick around for the ending. For the last 4 years, hospital funding has been frozen solid by the Ontario Liberals. And when you figure that inflation during that time has gone up about 2% a year, that funding freeze is actually a cut of about 8%. The 5 years before that were no better, and this current freeze is supposed to go on until 2018. Kathleen Wynne can try to blame all these cuts on the economy, or Stephen Harper, or the recession, but the truth is, her Liberal Party had choices. And when the time came to make those choices, her Liberals chose to cut and privatize hospital services. Thousands of medical professionals in hospitals were let go. You had to start paying for services such as physio treatments and eye exams. Other services were rationed. And vital services like rehab, ultrasounds, lab tests, even some surgeries were taken out of hospitals and put in private, for-profit clinics where making money comes first and patients second. There are real questions about who's monitoring these clinics, problems with user fees and questionable billing, unneeded consultations. And because the owners have to make a profit, these for-profit clinics cost us more than the same services delivered in a public hospital. But perhaps most damaging, private, for-profit clinics cherry-pick the easiest and most profitable services, which puts even more pressure on hospital finances and leads to more reductions in service and more hospital closings. And when communities can't provide hospital services, they stop growing. But we told you there is a solution, and here it is. We can reaffirm our commitment to healthcare. We can stop tearing down and start rebuilding. We can have the public, universal health care and comprehensive hospital service we need and deserve. We can make Tommy Douglas, the father of public health care, proud. All we need is for Kathleen Wynne to agree that it's worth doing. She can stop wasting our money privatizing vital hospital services. She can raise Ontario's hospital funding to the level most other provinces enjoy. And because she has her Liberal friends in Ottawa now, she can demand a better deal for all of us. A deal that will stop private, for-profit healthcare and invest in making our hospitals the full-service, integrated facilities we need. There are no excuses anymore. No one for her to blame for the destruction of healthcare. No reason to keep cutting. All Kathleen Wynne has to do is pick up the phone and get to work.